Welcome to this video presentation of the Core Test 7-in-1 urine drug testing panel. This 7-panel drug test is made by Core Tests Drugs of Abuse Screen for screening human urine for the presence of drug metabolites and actual drugs in the urine. You'll see this packaging, it's a single test included. It's an in vitro diagnostic. People often get IVD confused thinking it's a laboratory test or something fancy. It just means in vitro diagnostic. It means it's been used for human testing. The CE mark is applied to this for professional healthcare screening. You'll see it's CE and ISO certified for quality. If we turn the reverse foil over, you'll see there's some basic instructions for use here in terms of dipping it into the urine sample and interpretation of the results. This particular 7-panel screens for cocaine, amphetamine, cannabis, methadone, benzodiazepines, methamphetamine and opiates MOP. You'll see basic batch numbers and expiry dates shown on here. If we open this foil to show you the contents. In the pack, a couple of bags of desiccant. This is just silica gel to keep the membranes dry and absorb any moisture that may have leaked in. In a good quality foil, that shouldn't be an issue, and it should be quite crispy dry when it comes out. And this is your basic 7-panel. You'll see that on one side you've got 2 membranes, and on the reverse the additional 5. So in this sort of format they can load up to 10 membranes on this standard panel combo. The codings for the individual drug groups are shown, both colour coding and the 3 and 4 letter international coding, so MET for methamphetamine, MOP for opiates at 300 nanograms, COC for cocaine, AMP for amphetamine, THC for tetrahydrocannabinol or cannabis, MTD for methadone and BZO for benzos. So to run this test it's very simple. Just take the cover off the prongs that come out the bottom. The maximum dip line for this panel is the bottom of the actual card panel here, so you don't want to put these prongs into the urine sample any deeper than that. If I just bring a fluid sample in, and we'll demonstrate this for you, it can just sit in a normal plastic cup or any other collection cup that you have available for the sample. Obviously the depth must be about right so you're not over dipping this. And once you've dipped it for, only needs to go in for between 5 and 10 seconds, it can be removed, any excess tapped off, and the sheath reapplied. And you'll see already on this test card you've got the pink dye flowing in those 2 membranes, and if we turn it over, in all 5 of those. And what we have to do now is wait until the appropriate read time, which will be sent with the instructions to the test. So it's usually between 5 and maximum of 10 minutes, an average of around 8 minutes. But for negative test results, these panels can be read much sooner than that. As soon as you've got control and test lines forming, there's no need to wait, unless you are looking at a potential positive where you've got a clear control and no test lines showing earlier. But in all negative samples, as you can see on these results coming up here, we've got test and control lines showing on all 5 of those membranes, as you'd expect on a water sample. The pink dye in the background of these test windows will clear completely by the correct read time, but as long as you can see and make out the test lines at 2 or 3 minutes, that's a clear negative result, and that test can be completed and you can move on to the next test that you need to perform. So that is the Core Test 7-in-1 multi-panel or multi-drug screen test, screening for those 7 drugs that we've run through. It's very nicely showing you here, even on the panel, as well as if we refer back to the foil. You've got good advice in terms of interpreting your results. One bit of guidance we always give to testers when they're running these tests is the colour density, saturation and thickness of the test and control lines will vary considerably. As long as you've got a control line, it doesn't matter how thin or how faint the test line is, you must interpret that as a clear negative result if you've got a test line showing at the read time. There we go, thank you.